Often, it's the tiniest iris marking that completes the story. Welcome to the Iridology Education Channel. I'm Judith Cobb. Since 1981, I've been a holistic wellness coach using iridology, nutrition, and herbology to help people reclaim their health. Since 1985, I've been teaching these subjects to holistic health professionals like you to help you assess your clients more quickly and accurately. This channel is all about introducing wellness practitioners to constitutional iridology and showing you how it can deepen your client assessments without taking extra time. As you watch this video, ask yourself how this information could change the way you work with your clients or patients. If you're new here, welcome. Take a moment to subscribe so you don't miss the next videos in the series. Please like the video and leave a comment. I love hearing from you. Let's dive in. When we assess specific fiber placement, we are correlating what the irides show us with symptoms and known familial risks. Fiber structure is inherent, just like your fingerprint. The only way to change the lay of the fibers is to sustain an injury to the iris. We are looking for fibers that cross over other fibers. These are called transversals. Transversals can be found in every structural subtype. You are likely to see more transversals in the connective tissue structural subtype. In case you're not familiar with that subtype, I'll drop a link to that structural subtype intro video in the comments. It's rare to see an iris that has no transversals. Some eyes have a few, and some eyes have many. These are certainly easiest to identify in lymphatic irides. As with pigments, the general rule is the fewer transversals there are, the more important each one is. Transversals suggest an increased risk of inflammation, pain, blockages, poor wound healing, and scar tissue formation. They are not guarantees of those symptoms, so you'd never say, you have scar tissue in organ XYZ. And yes, Z is the Canadian version of Z. You'll want to ask your client about personal and family history surrounding tissue regeneration concerns. Knowing the client's history and correlating it with their concerns and transversals will give you insight into your client's tissue integrity. Once you've clarified that, you can guide them with practical steps. Are there dietary changes, lifestyle adjustments, or targeted supplements that would be of benefit to them? When does your understanding of transversals become really important? If you've got a client who has tissue or collagen regeneration issues like Ehlers-Danlos disease, if you have a client who forms keloid tissue, or if you have a client who does not heal well after injury or surgery or generally heals slowly. I have a fairly standard set of recommendations for clients who are undergoing a scheduled surgery. But if they have transversals, I custom build individualized programs because I know there are potential risks to their healing well. That's why we always start with a thorough health history and a clear understanding of what the client wants help with. The history provides context. The iris analysis explains why those symptoms are showing up. Then we draw on our training in nutrition, herbs, and lifestyle to create tailored, realistic recommendations. We won't get into talking about transversal placement or types of transversals today. That's included in the Dynamic Iridology Assessment System program. I invite you to reach out to me for details about the Dynamic Iridology Assessment System program if you're interested in learning more about this at a professional level. As a recap, the layers of an iris analysis are the constitution, which teaches us about the base chemistry predispositions, the structural subtype, which teaches us about tissue strength and nervous system tendencies, the constitutional subtype, which gives us deeper chemistry insights, pigments, which teach us about specific organ predispositions, and transversals, which give us information about specific organ and tissue predispositions to inflammation, pain, blockage, and scar tissue formation. Watch for the next video where we'll explore the basics of open and closed lacunae. If you're ready to learn iridology at a clinical level and integrate it seamlessly with the modalities you already use, click the link in the description for more information. Thanks for watching. We'll see you on the next one.